and what happens if masks aren't being worn in these locations? What are the odds that you'll get it?
So really good question, and I'm happy to provide a little clarity. You must be masked in all of these venues. You'd be masked when you pick up your food, let's say at a cinema or theater, and once you sit down in your designated seat, that's when you can take off your mask and enjoy the food that you've purchased. We don't want you walking around without a mask and potentially having an increased risk. So the compromise was that you can eat or drink when seated, but not to enable you to walk around unmasked. And the basic tenet of maintaining distancing and masking when not eating is always maintained, and screening before you go in to an environment like that. So it is, again, trying to have a balanced approach. We're reducing the risk. We can never eliminate the risk completely. And we all have to have a balanced approach in these venues. We hope in theaters, or if you're watching an OHL game, that you'll be distanced and that you'll enjoy the environment, and that we'll be able to increase the number of people in those environments over time. But we want to do it slowly, cautiously, and safely, given that Omicron is still quite active in our communities. Well, it will be a difficult February, but it'll be a better March. And as we head into the spring, I do hope it'll be much less risk in our environments. But I ask everyone to continue to maintain all the precautions that they've taken, and thank the 2 million Ontarians that have come forward to get vaccinated since January 5th to the 26th. They've all heard the call that we need to protect each other and ourselves. And the third dose has a significant bump in protection against severe outcomes. I absolutely encourage everyone, as your individual risk reduction, vaccination, and the third dose is absolutely key.
Next question.
Your next question comes from Brian Lilly with the Toronto Sun. Please go ahead.
Thank you, Dr. Moore. You're talking a lot about people needing to take their own risks, slowly reopening, but a lot of Ontarians might be looking around and saying we are moving a lot slower than other jurisdictions. And while you and the government, which are not the same, but you're both saying that you're following the science, other jurisdictions such as Britain, Ireland, the Netherlands, Denmark are all reopening much quicker. And they're saying they're following the science. Denmark will move to virtually no restrictions next week. So what is the difference in terms of the science that you're looking at and what they're looking at? Is it just a difference in how things are playing out in Ontario? Is it a different risk tolerance? What is the difference between what we're seeing in other jurisdictions in Europe and what we're seeing here?
A really good question. And certainly we're focused on the Ontario situation. In Ontario, for this particular wave, we've been really concentrating on protecting our health system, protecting the hardworking nurses, physicians, respiratory techs, dietitians, administrators. We know that they're 100% capacity already, and we don't want them to have to be at 110 or 115%. We want to be able to provide care to Ontarians at the right time, at the right place, if they need it. And that has been our focus. Health systems are unique to each country and or province and have certain limitations and capacity limits. And our goal, and thank you Ontarians for all the sacrifices you've made since January 5th, has been simply to protect the healthcare system, not to eliminate the virus. And we think we have plateaued. We think we've reached a crest, after which we hope there'll be a steady decline, and that the sacrifices that we've made have allowed the health system to be able to provide the right care at the right time. I do believe we've achieved that. And now we can slowly and cautiously remove the public health measures so that we don't have a sudden rebound and a negative untoward effect on our health system. So it's really dependent upon each individual health system. In Denmark, they put in a very profound public health measures long before we did, which were, I would say, in a severity index, much more severe and prolonged. We tried to time ours to be as minimal as possible, to be as balanced as possible, and to protect the health system as best we could. And I do think, thanks to all Ontarians, we've been able to achieve that. So great question. We're monitoring what's going on in all of these other jurisdictions. We're monitoring best practices, trying to understand how we can minimize public health measures, because no one wants these in place for, as the Premier would say, a minute longer than they have to be. We're trying to assure that our goals that we set out as a province have worked. I do believe they have, and now it's time to slowly reopen and avoid a rebound in cases and impact on the health system. I trust Ontarians that we can open safely and cautiously, and if we're making quicker progress, rest assured that we'll continue to follow the data and remove public health measures in a responsive means to have us back to as normal as we can be. It's a cautious plan, but it will always respond to data.
Follow up?
So I appreciate the answer, Doctor. And while I might find your plan too cautious, there are a number of people, including doctors, who are saying that you are being far too aggressive in moving forward, and that you're putting everything at risk, that we shouldn't have opened schools without more measures in place, that reopening businesses next week will put all of us at risk, that essentially we need to continue lockdowns. And so there's a lot of people who listen to these doctors who believe that, don't believe what you're saying, that we need to in some ways learn to live with the virus. So how do you convince nervous Ontarians that this is not something that we're going to get to zero before we start moving back to normal life? What do you say to people who are anxious because they're listening to doctors who say any reopening is too much or too soon or puts us or our children at risk?
Yeah, so great question, and it's a discussion I think in our democracy we should have, and I do want us to have a balanced, proportioned, and reasoned and data-driven reopening. And in the face of Omicron, I absolutely think we have to start to understand, we have to learn to live with this virus. And we've let our lives be controlled for the last 2 years in a significant amount of fear. And now we're going to have to change some of that thinking. We've got vaccines that are safe and effective. The third dose is proving to be exceptionally protective, 88 to 95% against severe outcomes. We now have oral antiviral outpatient therapies. Yes, it's 10,800 dose treatments that are available to Ontarians in January, another 10,000 in February, but more will be available. And I do believe further medications and other vaccines may be available to us, like Novavax in the near term. So the pandemic is evolving. We're getting new interventions. We may get even newer vaccines that some of those that were hesitant may want to review. But we have to have a balanced and proportionate response to this virus. And we have to look at the mental, the physical, the social, the economic, and the educational impacts that this virus has had on our children and our businesses, and learn from the last 2 years that sometimes we were too cautious. It'll never be exactly right for everybody, and it's healthy to have debate, but we do have to have a balanced response to this virus and learn to live with it.
Last question.
Your last question comes from Colin DeMello with CTV News. Please go ahead.
Hey, Dr. Moore, just talking about the data that you were mentioning, you've always been a very data-driven person, but over the last number of weeks and months, I mean, you've really started to pare back the PCR testing, rapid testing, COVID information in schools. Now you're removing contact tracing requirements. So all of those tools over the past 2 years were designed to tell us, if there's smoke, there could be fire. How are you going to know now if things are getting worse?
If things are getting worse, we still have a significant amount of PCR testing that's done across Ontario. So 40,000 tests or more on a daily basis. And the percentage of them being positive was averaging for 7 days 18%, but today it's 14%. That's trending in the right direction. So we still have that as an important surveillance signal. We still have testing for anyone hospitalized in Ontario, and that number today is trending in the right direction, down 371 cases admitted to hospital. The ICU numbers are stable. The number of individuals requiring ventilation, sadly, it's going up a little, but not accelerating rapidly. So all of those metrics are still very good. And then we put that in the face of 2 million additional Ontarians got vaccinated since January 5th. And the additional protection that we have against this virus through improved vaccination coverage at a population level. More and more of our children are getting protected with their first and now their second doses, 5 to 11 years of age. And now for those that are unvaccinated or immunocompromised and get COVID-19, we have outpatient oral antiviral therapy. So to me, this is giving us greater confidence. And Ontarians have stayed relatively united in adhering to all the best practices, masking in public, on buses, on subways, on protecting each other through the basic public health measures, as well as I think 90% of the 12 and up population being vaccinated, I think is brilliant. Together, all of those metrics inform us on a daily basis of where we're heading. And I do believe we're cresting and have reached a peak. So the sacrifices Ontarians have made is working, and that we can now start on the 31st to safely reopen in a balanced, proportionate, safe, and cautious means.
Okay, thank you. And it sounds like from everything you're saying today, the endemic really is on the horizon here. So can you give me what you think you want to see before saying, we can lift the masking requirement, we can lift all of the physical distancing requirements? Do you think that might come before May, as an example?
I'm very, very hopeful, Colin, and thanks for that question. So as we said, we thought January would be tough, and it certainly has been. And my condolences to anyone that's lost a loved one. February, I do hope we're cresting and we'll start to decelerate on the health system impact. I do think March will be a much better month, and certainly by April, we'll be heading to that low rate of activity in the community. It always helps to understand that the weather's going to get better. We will get outdoors more. There will be more sunshine every day. I hope you're hearing hope in my voice. And as we head to that low endemic rate, that's when we review all public health measures that have been put in play. No one wants them a minute longer than they have to be, and they have to be proportionate to the risk. I do see the risk going down less and less day by day, month by month going forward, all the while staying humble in front of this virus, deep humility that I can make these statements, understanding that we have to monitor for any new variant, any change in the protection from the vaccine. And I want to assure Ontarians we've got a great laboratory system and network monitoring for any new variant in Ontario, good whole genome sequencing, and good partnership at a national level with the National Medical Lab and with the WHO to continue to monitor for any other variants that arise that we may need to change our strategy on. But so far, I am hopeful and anticipating March and April having much lower risk for all Ontarians.
Thanks, everyone.